What do we want? Fair pay. How do we get it? Strike.
Day 3 of the junior doctors' strike and still no sign of a resolution. The arbitration service ACAS has confirmed that it's been in contact with both the British Medical Association and the Department of Health and Social Care, offering to help with the dispute. This is where ACAS is based, just a stone's throw from the Department of Health. But the problem is, the Health Secretary, Steve Barclay, has said as a precondition to any talks, the junior doctors must call off their strike action. The junior doctors say they will not accept any preconditions before they begin discussions. Now, senior NHS leaders are saying something has to happen, that it is urgent that this is resolved, that they need to get round any table, whether it's ACAS or somewhere else, just get round the table. At King's College Hospital in South London, the chief executive made no secret of his frustration. So what needs to happen?
Unquestionably, and I implore both parties to stop explaining and saying why they can't start negotiating and sit around the table for the sake of our patients and our staff and agree a deal as soon as possible.
And this comes on the same day as NHS England published its monthly performance figures. There were some improvements in long waits and in cancer waiting times, but the figures show there were more than 7.2 million people waiting for NHS treatment in England at the end of February, a record high. In emergency care, more than 1 in 10 people were waiting more than 12 hours to be treated in A&E. It's the first time this data has been released from the point of arrival, rather than the decision to admit a patient. Average ambulance response times for Category 2 calls, which includes suspected heart attacks and strokes, rose to nearly 40 minutes in March, far exceeding the 18-minute target.
Well, we've had repeated periods of industrial action this winter, nurses, paramedics and now junior doctors. We've been working hard, despite that, to improve the long waiting times. And of course, junior doctors are a very important part of that. But inevitably, these periods of strike action will have an impact that we are likely to see in the weeks and months ahead.
The waiting list backlog is one of the Prime Minister's key priorities, and today he said it could be dealt with by more use of the private sector.
Ultimately, if the patient is still getting the care they need, free at the point of use, we shouldn't be so hung up on who's providing it. We should be using the independent sector to provide choice, to provide competition, drive up quality. It's worked in the past, and we're going to do more of that going forward.
The junior doctors, that's anyone below consultant level, say their pay has fallen in real terms by 26% over the past 15 years. They argue pay restoration would require a 35% rise. The Health Secretary has described that as unreasonable.
All want the same thing.
George Dovey has been a junior doctor for 5 years and earns £19 an hour. He has another 6 years to go before becoming a consultant, if he makes it that far.
The joy in what I do is not there anymore because I'm struggling to be able to enjoy my life outside of work. So yeah, I am considering leaving.
After all that training, after all those exams, after all that hard work.
Yeah, it's not pleasant to think about it. I never was someone who gave up, and I don't want to give up, and that's why I want to fight to increase our pay, to improve the working conditions of doctors, so that way we will stay.
What do we want? Fair pay! When do we want it? Now!
Tomorrow, the Royal College of Nursing will announce the results of the vote on its 5% pay offer recommended by the executive. The outcome is not immediately obvious, and if the membership rejects it, the nurses are likely to join the junior doctors back on the picket lines, placing even more pressure on the government to review the pay deals.